Doc, well, the numbers do look good. At least the numbers released by DOH I think our infectivity rate is down to 0.57. Pero on the other hand, ito nga on the other hand On the other hand, may warning yung Philippine Hospitals Association na
Puno pa rin.
too small to make a difference yung pagbaba on the ground pagbaba ng numbers sa mga ospital, and they're still at 100%, many of them are still at 100% capacity, and that the numbers do not really reflect the realities on the ground. So I'd like you sana lang to contextualize for us. Ano ba talaga ang itsura dyan? For example, sa inyo?
Yes, in a way, the overall number of cases has really significantly gone down for the past 2 weeks, and especially beginning last week and then today, admissions are still there, but not as in terms of volume previous month, like September and August. Mm-hmm. The other problem here is, I think, the ICU capacity is still not good to look, because even in most, like in the government hospitals where I'm affiliated and private hospitals, more or less we still are in the 70 to 90% capacity of the ICU. And that I think most of those admitted are really the severe critical and the vulnerable population. So I agree somewhat with the Philippine Hospital Association na medyo hindi pa natin nakikita talaga yung tinatawag natin na medyo nakakaluwang-luwang na tayo. And that in itself, dapat hindi pa rin tayo maging complacent. And we really still have to be on our guard in terms of the health protocols.
Pero Doc, nakita niyo ba yung mga video na lumalabas over the weekend at saka ngayong araw na to? Kasi, we don't want to be complacent, but you look at the pictures, and it's not even about complacency. For a lot of people who have to go to work, siksikan ng mga pila, siksikan ng mga bus. What does that give you in terms of what to expect in the coming weeks?
That's always the risk when we downgrade the alert level. And when we downgrade the alert level too soon, since we now have a downtrend in the cases, there are really uncertainties in the next 2 to 3 weeks now, because if these people are in congregation, in gatherings, and even the fact that a lot of them are already in siksikan na sa mga transportation system, we already experienced that before, okay? And I'm just hoping na itong mga nangyayari ngayong mga ganito, hopefully these are the vaccinated, the fully vaccinated, dahil the chance really of higher cases will really be burdened on those unvaccinated.
So do you think the complacency that people are feeling now applies to people who are now consulting in the hospitals with doctors in their clinics, with something that they didn't do before, even if it was non-COVID related? Are there more admissions now? Do you think people are feeling more safe to go to hospitals and to clinics to consult? Are you seeing that sense of complacency also?
Well, I think ang nakikita natin ngayon, nag-open up na rin yung mga non-COVID admissions, mga cases. So, meaning they now have some confidence in going to the hospitals for consult and for other things related sa health nila. So that's something na nakikita natin na maganda ang pananaw. But again, they should be put into a context that they should always be not complacent with the health protocol. Okay yan sa mga doktor, yung tinatawag natin na proactive, preventive. Pumunta sila sa mga clinic, hindi na sila takot. Probably because they are also vaccinated and they have that confidence na pag bakunado ka, mataas ang protection mo over the unvaccinated. But again, very important pa rin, maski bakunado ka, we still need to protect ourselves, and dapat mag-iingat pa rin.